Would you like to guess where that is? Well, it's in the cornea. And all the other parts of the eye would be totally useless if just the cornea, if the cornea was opaque collagen like all of the rest of the body. You see, you can't see through my hand there, but you can see through my cornea. You're seeing through my cornea. If you look in a mirror and when you see the color of your iris, then you are seeing through the cornea to your iris. And so it's clear, it's perfectly clear, otherwise you wouldn't be able to see. Also, understand that all parts of the body need oxygen, which is carried by blood throughout the body. But there's one problem. Blood is also opaque. You can't see through it. And, well, how does the cornea get the oxygen that it needs? It doesn't. There's no blood veins going into it. Unlike all of the rest of the body, it gets the oxygen directly from the air. It's the only part of the body that does. The cornea gets the oxygen it needs directly from the air. It's not brought in through the veins and by the heart like all the rest of the parts of the body. Now, let's move on to the colored part of your eye, called the iris. Now, it can be various shades of color, which is fairly remarkable just in itself, because recognizing that the iris is actually muscle. Now, do you know where there's another? Eyes can be anything from green to blue to brown to gray and various shades in between. Do you know of any other muscles in the body that are blue or green or brown? No, there aren't any. The eye is beautiful, and it contrasts beautifully with the white part of your eye. But what does it do? Well, it does the same thing that the aperture in a camera does. The camera is often used as a comparison to the eye. And if we were using that analogy, the cornea would be the first lens of the camera. And I've got a camera here. Where is it? This is a kind of an old-fashioned camera these days. It's an old SLR, single lens reflex, that I have. And this is often used as a comparison to the eye, and for good reason. There's a lot of comparisons from a camera to the eye. Now, one of the things, if we were going to use the analogy of a camera and the aperture or opening, the aperture is the opening of the iris. Now, let me just show you this for a moment. I've taken the lens of this camera off of the camera itself. And if I take this, and I hope you can see this, but if I take this and I can shut this down by moving a little button back here on the back of the lens. And I'm hoping that you will be able to see that. But you see how it's closing and opening there. Now, the reason it's doing that, or the reason a camera needs to do that, and modern cameras, of course, are even more complex than this one is, but this one suffices our purposes in order to show you what it does. But what does it do? Well, when you go out into a bright daylight, like from a room, and it's very bright outside, what happens is your iris shuts down the amount of light that is coming in to your eye. And likewise, if you were coming from the outside and you came into a building and where there was not a lot of light, then your eye would open back up. You can see this kind of thing well and sometimes in a cat's eyes, although a cat's eyes are elliptical and they work differently than our eyes. That's something else we'll discuss, but the difference in various creatures' eyes. But this is why it does it. But how does it do it? That's what we want to know. Have you ever thought about this? How, knowing that all muscles contract, there aren't any muscles in the body that push, or they all contract, and they generally work in pairs. I think they all work in pairs. How would you expect the muscles to be composed in order to achieve the opening up Well, let's think about this a minute. Let's draw another picture here. Let's say this is your eye. This is the pupil here, where the light actually goes through. If you went into a dark room, how would the muscles need to be arranged or composed in the iris in order to open up and get bigger? Well, they're composed in a radial form like this, so that when they contract, see, they're mounted out here, and when they contract, they pull open the iris to let in more light. Now, these muscles are tiny, microscopic muscles. Okay, if that's true, then how would the muscles be composed, knowing that they can't push it back and keep a perfect circle? How would the muscles of the iris be composed in order to concentrate or pull in and bring the pupil back down to a small portion to where you would need if you were going out into bright sunlight? Well, actually the way it is there is another whole set of muscles behind the radial muscles. It's like this, like the spokes of a tire. There's another whole set of muscles that are arranged in a circular pattern behind the radial pattern like this. And when they contract, they close down the pupil. And so that's how it works. Is it simple or is it complex? Now, behind the iris is the second lens of the camera. And most cameras, the eye rather. Most cameras, well, I think all cameras have at least two lenses, some more. This one here has two lenses. And you can see that when I move this wheel here, that this lens, the front lens, actually moves forward and backward. Incidentally, a fish's eyes actually work this way. They actually move in and out in order to focus, just like this lens here does. But that's not the way our eyes work. Ours are more complex than that, and far more complex than this. Now, just for the side right now, do you think that this lens washed up on the beach somewhere? Do you think it came up out of the earth? Or did someone design this lens for a specific purpose and for a specific use? Well, it's obvious that it was designed, and very well designed. So, is it simple or is it complex? Now, the lens of our eyes are much more advanced than the fish's eyes. It uses the same lens and actually changes shape automatically. The lens of our eye, we've got the iris in here that controls the light, and then behind that we have the real lens of the eye, which sits right directly behind the pupil and behind the cornea, and there are tiny, tiny microscopic muscles that are attached to the edges of this all the way around. And what happens is we use the same lens. We don't have two lenses. Well, we do if you would consider the cornea a lens, but rather than our lenses having to push and pull forward and backward like this, we actually use the same lens, and in a similar way to the iris, these muscles on the outsides of the eye that go all the way around it actually pull automatically